Peggy, and we're in my kitchen, and we're going to make these things, so it's going to be interesting. And we're going to take Jake to the vet to talk about getting his teeth cleaned. So it's going to be a busy show. We're going to do these first because they take about an hour and a half to cook, and then we'll come back and see how they taste. So do you know what they are? Have you ever seen them? They're actually flower buds in the thistle family, and they're very expensive, much more than they used to be in the good old days when I was a kid, and we used to have them all the time. But these run about between $4 and $5 a piece, and they are artichokes, and they're in the thistle family, and if they were allowed to bloom, they would be a Sputnik of purple, tiny, delicate flowers. So just like the thistle flowers that are on the weeds in your garden. The best way to cook them is to steam them in a big pot. My brother actually does them with the old family recipe that we're going to use today, but does them in a pressure cooker. I've never actually tried that, but it may cut down on the time. So the first thing you have to do is cut off the stems, and you want to make sure that they're going to sit flat like that, because they have to sit in the bottom of the pot. And then also you want to cut them flat on the top. Because this is where you're going to stuff them, in between all of these leaves. So let me cut all of the rest, and then I'll show you what we're going to do with them. Now you can see these artichokes are cut on the top and the bottom, and they've been thoroughly rinsed out, and you run them under cold water and you pull the leaves apart to get the water to run through, and then you kind of have to pound them to get the extra moisture out, and you can let them drain for a little bit too. So we'll just let them sit here for another second, draining on this towel. You can see they've all been pulled apart a bit, and we'll deal with the stuffing. It's very simple. You use some seasoned Italian breadcrumbs that you could buy ready mixed. I happen to love this particular kind. You need some garlic powder and olive oil, and that's it. I almost always prefer to use fresh garlic and press it and mix it in. But in this case, we want the dry breadcrumb mix to be able to filter all the way down between the leaves, and if it's gooey, it's less likely to do that. So in this one case, I really do prefer to use the powdered. So I just sprinkle some in there and mix it up. Now, artichokes are almost entirely grown in California along the coast. On Route 1, you can see artichokes growing on both sides of the highway. The plants themselves are really quite magnificent. They grow in a pyramid-type shape with tiers, like a cookie tray that you would serve cookies on, the bottom tray, the middle tray, and the top tray. And the bottom has more leaves, and that's where the very small artichokes grow. Remember, they're flower buds, and they grow where the leaves attach to the main stem. And those are the ones on the bottom tier that you find in olive oil in the supermarket, already prepared in jars. On the next tier up, sometimes there's as many as 4 tiers, is where you find this size bud, again, where the leaf attaches to the main stem. Very often on the top you get one enormous artichoke at the peak of where the plant grows, and those are very rarely available for sale, but they're enormous and quite spectacular. If allowed to continue to grow and not harvested, they all turn into these Sputnik-like purple flowers. Quite spectacular, but then of course inedible. Years ago, I tried some experiments to see if we could grow them in New Jersey. And what we did was planted them in the field and covered them for the winter, because it takes 2 years for artichokes to produce. The first year it's just foliage, and the second year is when it produces the artichoke flower, like a typical biennial flower. So then they die. So what we tried to do is protect them over the winter to see if we could allow them to survive and go into the second year and produce the flowers. That failed. We also attempted to grow the seedlings under refrigeration to trick them into thinking they'd been exposed to the cold winters. Theoretically, in the literature, that's been successful. We were not able to do that. In recent years, new varieties have come about that are supposed to produce flowers in the first year. My understanding is that some of the growers in New Jersey have attempted that, but they are still not yet under production in New Jersey. So the artichokes that we get still almost entirely come from California, and occasionally some from the Mediterranean. So you want to pound that down, spread out the leaves, make sure that it really gets down in there. You can see they get wider as you stuff them. So you need to make sure you allow enough room in the pot that you're going to steam them in for them to get a little bit bigger than when you started. Okay, here we are. They're all stuffed, and I'm just going to dribble a little bit of olive oil around the top of each one. Maybe about a tablespoon to 2 tablespoons of olive oil. Depends on the size of the artichokes, of course. And that will cook down, and it will help to move the stuffing down into the base of the plant. Now, ordinarily, I do that in the pot to not make a mess, but I'll show you here just a little bit, not too much, on the top of each one. And then you put them in the pot, and you put about 1.5 inches of water, and you let them steam. The trick is that you do have to add water during the course of cooking because it will boil away, and you don't want them to burn on the bottom. You also don't want to put too much water in to begin with, or it will bubble over the top and wash away all the stuffing. So that's kind of a little tricky. You have to keep a close eye on it. So let me put these in the pot, and we'll turn them on. We'll steam them for between 1 hour and 1.5 hours. It depends on the size of the artichokes. These are rather large, so I'm going to go with 1.5 hours because you want them tender all the way through. And then we'll have a nice little treat for lunch. All right, these are done, and they're very hot. And we're going to scoop them out. Put them on this platter. And we're going to have a couple for lunch. So we'll put 4 on here because I'm going to have them for dinner with my family. And then I'll put 2 on plates for us for lunch. In the meantime, you can take a look at these little beauties. All right, this is the part of the artichoke leaf that you eat. This little tender, kind of thick morsel at the tip. And you eat all of these, and you work your way down. Now when you get a little bit inside, you get the stuffing on it too, which of course adds to the flavor. And you eat all the leaves. As you get in, there's more and more tender on the bottom of the leaf. When you get to the very center, I'll show you that they're actually, you can eat the whole leaf. And then you get to the heart. That's the best part. Now when you get to the center, you can eat the whole thing, like that. Rather than make you wait till we get all the way to the bottom, I'm going to take off these leaves, all of which are edible, and show you this part here. This is actually the flower when you get to the very center. And these become almost thread-like. We'll take a look at that. Okay, let's move all this over. Get rid of these little tiny things. And you'll see that this part right here needs to get scooped out. This part is not eaten. You can see it's hair-like. Can you see that up close? See how feathery that looks? If you eat that, it'll tickle your throat. It's not comfortable to eat. So when you get down to that part, which is actually what would have been the flower, you don't eat that. what's left is the heart of the artichoke. This is basically the same as what was on the bottom of each leaf. It's worth all the work to get down to this. Artichokes, they're not just for breakfast anymore. We have lots of critters at Blooming Acres, and they require a significant amount of care. Of course, the more care you give them, the more they love you back, and so it's definitely a fair trade. But doggies have teeth. And my kids had braces, and that cost a lot of money. And it's important to take care of everybody's teeth, including the dogs. And I'm with Dr. Michael Petranto at Twin Rivers Animal Hospital because February is
dental month
for dogs.
For dogs and cats.
And cats. Oh, I didn't know about the cats.
Yes.
And this is Jake, the wonderful collie, and he's very gentle and has a very long nose and a lot of teeth.
A lot of teeth. And you know what? Despite how long their noses are, some dogs' noses are short. Some dogs, they all have the same number of teeth.
Really?
Dogs
Even
have,
those little squished-faced dogs?
Yep. And that's one of the problems because they have the same number of teeth in a smaller area, so they kind of get crowded, and sometimes they're more prone to periodontal disease.
Dogs get periodontal disease.
Absolutely.
Just like people.
Just like people.
What am I supposed to do? Brush his teeth?
Yeah, that's a good idea, and there's ways of doing that. But the best thing is to have them evaluated every year and then cleaned professionally by your veterinarian.
So you're not only a doggy doctor, you're a doggy dentist?
Absolutely. We clean the teeth, scale them, polish them, and then we evaluate the teeth. You know, some teeth have to come out sometimes, depending on if there was root abscesses. A lot of times we'll see broken teeth. You know, dogs chew on a lot of things,
right.
Sticks, bones. And
rocks. I've seen dogs chew on rocks.
Absolutely. And we'll see cracked teeth. And those teeth are painful, which sometimes they don't always show the owner. You know, they're still eating, but we notice it when we get in there and polish the teeth.
You're going to look at his teeth?
Absolutely. We're going to take a look at these 42 teeth that he has.
Well, I know he's missing at least one, so 41 teeth.
41. Normally 42, and cats actually have 30.
How come they have so many less?
A little less.
Yeah?
They still perform the same function, but a little less.
But they're hunters.
Yeah, but they have, the teeth that they do have are very good for grasping prey and chewing. So.
Okay, well, let's show everybody your nice smile, Jake.
We're going to see his smile and try to assess what kind of periodontal disease he has, if any.
Now, Jake is 9, so
I know, and at 9, they usually do.
Have something, right?
These teeth in the front here, these little teeth, are called the incisors. And there's usually 6 across the front and 6 on the bottom. These actually look pretty good. Some of the things we look for is we like to see the tooth without a lot of recession of the gum. And these actually, this gum looks pretty good, and there's not much wear on the teeth too. I guess he's not a big chewer.
He doesn't chew rocks.
Yeah, just his bones,
yes,
just his bones. Then we go to these big teeth in the front. These are the canines.
What's that brown thing? There's one that's brown.
That's the tartar on the teeth.
The tartar? Even that one on the bottom?
This canine here is a little different color.
Yeah.
That's called where the tooth has been injured in some way and it's healthy, but some of the tooth has, some of the enamel has been worn, and that's why the tooth looks brown like that.
But it's okay.
But it's okay.
Doesn't need to come out.
And the reason we know it's okay because when we look at the base of the tooth where it goes into the gum, it's nice and healthy.
Okay.
Nice and pink.
Okay.
Okay.
You're in the pink, Jake.
If you see bleeding from the gums, that's a problem. Just like in people. That's right. As you move further back into the mouth, they're the teeth that usually have the problem because that's where the saliva constantly bathes the teeth, and that leads to some irritation around the teeth. And if we look at the molars back here, these are big teeth. Look at the amount of tartar on that tooth. And that is because can you see this brown? Yeah, right here? Yeah. And the gum's a little redder.
Yeah, it is, a little pinker.
And that's a tooth that has a significant amount of tartar.
So he needs the doggy dentist?
Yes. That would be scaled off, just like they use an ultrasonic scaler on you in the dental office, and then polished to seal the small crevices that the scaler has created.
Now, we've already made an appointment for Holly.
Yes.
And Holly's going to be
older,
12.
right.
She's going to be 12, even older than Jake, and she needs to have this done. But you said that she had to have a test.
Yes,
some kind of
yes,
test.
that's very important. Because when we tell people that, you know, dogs need dentals, cleanings, and, you know, people, not all people, some people have to be sedated when they have a cleaning. All dogs and cats have to be put under anesthesia to have a dental cleaning.
They won't stay
still. Exactly.
Jake is being very
and
good.
The other thing too, the other reason is because, you know, when they scale your teeth and you have all that fluid in there, and the dentist will ask you to either swallow or spit into the fountain.
Dogs can't do that.
Dogs can't do that. So the only place it'll go, it could go down the chest
and that's
into
not
lung,
good.
and that's not good. So that's why when they're out, they're intubated. A tube is put in so we don't get fluid down there, and that's another reason they're put out.
So what do you test for? You have to do some kind of test.
So what I tell people, because when you mention anesthesia, you know, people get a little concerned, a little anxious, but it's a light plane of anesthesia.
What does that mean?
Means that they're under, not that this is a painful procedure, so we don't have to go real deep on the anesthesia to prevent pain. We're just putting them under lightly to relax them and to make them motionless so we can clean the teeth.
So it's not a deep sleep.
It's not a deep sleep. Now, we try to minimize that risk of anesthesia because we're all concerned about it, and the way we minimize that risk, we do pre-anesthetic blood work, just like if you or I were to go under some type of anesthetic procedure. And that pre-anesthetic blood work tells us that there's very little risk to put this patient under.
Well, Jake is 9, and this will be, if we get him done, it'll be his second time.
Yeah.
It's the second time for Holly, so it's not every
And actually,
year.
these teeth look pretty good for having, so you're saying one dental Jake had?
He had one about 4 years ago.
Yeah, they look pretty good for that. I mean, the amount of tartar on these molars are, you know, pretty normal for this age dog. But you'd be surprised how they look after all that comes off, and it's fairly easy to come off.
So he'll have a perfect smile?
A perfect smile.
Jake, you'll have a perfect smile.
Now, the dental cleaning doesn't just stop there, unfortunately. That's our job, to get all that tartar off, because this tartar here, you would never be able to brush this off. That's on there like
right, needs professional.
But once it comes off, you talk about the duration of time between dentals, you can lengthen that time
By brushing their teeth.
By brushing their teeth.
Okay.
Exactly.
Okay.
And you know, getting the outside here is fairly easy with a soft bristle brush, and there are certain types of paste that are used, and a lot of them are flavored. Toothpaste. And a lot of them are flavored.
What are they flavored like? Steak?
Chicken. Yes.
Really?
Yes. Absolutely. Okay. And some dogs don't like to brush in their mouth. A lot of cats don't, and that's why these finger brushes are great. You can put this right on your finger, and they have bristles here. You put the paste on there, and then you can kind of gently work it inside the dog and cat's mouth. Now,
I'm not sure I'm ready to do that.
You know, and you know what? Starting a dog at 9 years old may be a little difficult, or a cat at 9 years old.
So you should start when they're puppies.
You should start when they're puppies. You know, even if they don't even have their adult teeth yet, which don't come in till about, you know, 4.5 months or so, you should still
get them used to it when they'll let you do just about anything.
Exactly,
right.
Exactly.
Okay, Jake, I probably won't be brushing your teeth, honey.
Okay. Now, people often ask, is there anything else I can do short of this? And, you know, there are a lot of good dental chews out there commercially.
And they work, they help?
They do work. They do work. There are a lot of dental chews. This is probably
the most effective?
The most effective. Well, the dental scaling and polishing, what we do, is most effective, and this is the best thing. The brushing is the best thing that the owners can do at home. Okay?
Okay.
Yeah. So these teeth look pretty good. There's always two sides, because we're looking at 42 teeth, and this one here, this molar on this side has about the same type of periodontal disease too. And the other thing about dentals too, I mean, we do it mainly for the teeth, but to be honest with you, we pick up a lot of other things when they're under anesthesia for dentals, especially in older dogs. Just like in people, we examine the back of the mouth for certain types of masses, tumors, and we often find them because it's very hard for the owners to see that while the dog's awake. Okay. It's very hard for the veterinarian to see that.
So not only is it corrective, it can also be preventative.
That's exactly right. Exactly right.
All right, Jake. Well,
So Jake will be having his dental soon, I'm sure, and his pre-anesthetic blood work, and
Don't worry, sweetie.
off to a
We'll
pearly,
take
pearly
good care of you.
white smile.
All right, now smile for the camera. Okay, well, thanks for sharing all that important information, Dr. Mike.
You're welcome.
Jake, you'll be coming back soon, okay? This is an Amaryllis, and it started out as just a single bulb many years ago, and it now has 3 growing tips. It's time to divide it. And you divide it, the best time to divide it is when you're about to get it started again. And now's the time of year to get them started. You can see here's another one that has also divided itself into 3, and I waited a little too long. It's already starting to grow. These are actually the flower buds. And if you look very, very carefully at the flower bud, you can see a seam up the center. So if you're looking and you're not sure if you're getting leaves or flower buds, look for that seam, because if it's a leaf, it won't have that. And what generally happens is the flower buds emerge first. Once in a while, you'll see a little bit of leaf and then the flower buds. If you get leaves emerging and no flower buds showing, chances are you're not going to get them. So let's see if we can get this one out of the pot. It's been dormant. It's very dry. It's coming. All right, well, this doesn't want to come out. We're going to try one more thing. You can use down in the hole in the bottom. Sometimes you can just push it out. There we go. Okay. All right, well, this has been in this pot for probably 6 or 7 years, so it's not surprising that it's a little, look at all those roots. Oh my. Okay, well, we're going to try to break it apart. Remember that it will make new roots. Here's a little one. I'm only going to put one back in the original pot. And when it gets started, just like bulbs in the garden, like your daffodil bulbs, it will make a whole new root system as it gets going. So even though we're tearing off and trying to save some of the roots, it will reestablish itself. Oh, there we go. Look at that beauty. Oh, and there's, a surprise. Another one. So there's one. And we'll break off some of this excess over here on this one. There you go. Okay, so let me get a couple of more things and I will be right back. So I washed this pot out. I like to start with a nice clean pot, but it's a pretty clay pot. It does have a little crack in it, but I'm not going to worry about that. There is a drainage hole on the bottom, and one of my tricks for covering up the drainage holes is to just put a little piece of paper towel in the bottom. It will still allow for drainage, but of course that way, as you're filling it with soil, nice fresh potting soil, it won't run out the bottom, which of course would make a big mess. Now I'm going to take the biggest bulb and put it back in this pot. But in cleaning up the roots from the bottom, I found even another one. So I have 3 tiny bulbs and then this secondary bulb. So we did pretty well from this one plant. Now the thing about Amaryllis bulbs is that you don't completely bury them. You can see these are above ground. The other important thing is that once they finish blooming, they need to get blazing sun. In fact, if you can put them outside in the garden, that's really your best bet. They need to produce a minimum of 5 healthy strap-like leaves, leaves that are long enough to stand up on their own, not flop over, not have to be tied up. 5 healthy leaves in order to replenish the bulb sufficiently to produce a flower next year. So I'm putting in nice, fresh, loose soil, pushing it down a little bit to get it between the roots. So you can cover about half of the bulb as a general rule of thumb. So until the flowers emerge and it actually blooms, you can give it as much sun as possible. While in bloom, take it out of the blazing sun so that the flowers last a little bit longer. When it finishes blooming and all the flowers have faded, cut off the flower stalk, put it back in the sunniest window you have, and when all danger of frost has passed, move it outside. Come September or October, stop watering it, let it go dormant for about 2 months, and then you can start it up again anytime between, say, December and March, depending on when you first make it go into dormancy and when you have the burning desire to make flowers. I like to do this in the winter, January, February, when there's not much other gardening going around. I find it very satisfying. So there you go. Give it a good drink, and in about 6 weeks, you'll have gorgeous flowers.